Uganda Cancer Institute is in the final stages of establishing a fully fledged pediatric and adolescent center. Currently, the institute has a pediatric clinic that admits children from 0 to 18 years of all types of cancer in the country with a bed capacity of 40 patients. The nursing officer at Uganda Cancer Institute Pediatric Department, Kemigisha Misiki, says the most common cancer at Uganda Cancer Institute is bucket lymphoma with a survival rate of 55%. Acute leukemia has survival rate of 47%, among others.
Common ones are leukemias of all types. Then we have Wilms tumors, we have the bucket lymphomas, the lymphoblastic lymphomas, osteosarcomas, all those ones, we do receive them in large number.
Cancer begins when healthy cells change and grow out of control. And in most types of cancer, the cells form a mass called a tumor.
Cancers, take an example, the leukemias, they tend to have chronic anemia, they keep transfusing with no improvement, they have chronic fevers, test malaria, it is negative, but the child has fevers. They have bleeding tendencies. They can bleed in any part of the body. They tend to have uncontrolled body pains, like the joint pains. So those ones are some of the symptoms that can trigger you to think maybe something awkward could be happening to this child. And because
the head of Department Childhood Cancer, Dr. Joyce Balagade, says that there is a lot of research going on to discover new treatments for childhood cancer, and the research is to greatly improve the overall survival rate for children.
Childhood cancer is real in Uganda, and according to the Global Can, we expect every year about 2,000 children to be diagnosed with cancer. However, only a third of these children are presenting to care, either here at Uganda Cancer Institute or at our regional cancer center in Mbarara. This means that 70% of our children in Uganda are not presenting to care.
The department has a playroom unit where these children go and spend some time off their beds and treatment to socialize and play. The room takes in 10 children at a go and has various toys, books for shading, storybooks, and one trained therapist. Mariam Dagire, who manages the playroom, says the children feel safe inside the room as they get to meet other kids battling the disease.
We call their sanctuary. They know when they're in here they can play. There will be no nurse calling to prick them. There will be no blood draws, no treatment, so they feel safe in this room. Also, through this play therapy, children can express how they are feeling. They can talk to you more freely when they are here than when they are on the ward, in their beds, because they are scared when they are on the ward.
Ndagide says the nature of cancer treatment gets a toll into the children and sometimes affect them psychologically.
On our ward, at least our children are not as depressed as they used to be. Sometimes people imagine children don't get psychologically sick or depressed, but these children also think, they will wonder why they are stuck in hospital, why they don't get to go home. But when they come in here, they try to feel like normal children. It gives them a feel of being at home. Because when they're here, they can play, they are happy, they are smiling, they make friends. Easy. I must say, these kids are brave. They get almost needle pricks on a daily basis, blood draws. Chemotherapy, I don't think there is no treatment that is as harsh as chemotherapy. They get their treatment. A child who came in fat, chubby, they start to lose weight, they are vomiting, they lose their hair. It is not easy. It is not easy working here. But we keep looking at the positives. We pray to God. We try to we be there for each other. We counsel each other. And we move on.
Different pediatric oncologists re-echo that childhood cancer is curable and it's not a death sentence.
Cancer does not only affect adults, cancer also affects children. But the good news is that cancer in children is curable if it's got early. So every time your child is sick, if you're noticing they're getting treatment, they're not improving, come to the Cancer Institute. perhaps it could be cancer, or talk to your healthcare provider. They can be investigated. If we can get these children early, we can treat them and they can.
In children, it is curable. So what they have to do is always to seek for proper care. Consult those who really know what is happening. Many have got cured, but many take it as though it is now end of life. So some even say, we shall produce other children.
Mark the end of Childhood Cancer Month, Uganda Cancer Institute organized a party to entertain the children where they cut cake with numerous games. The Global Initiative for Childhood Cancer in Healthcare System pledged to improve the pediatric cancer survival in 2030 by 60%, aimed at saving 1 million lives. Constrained countries